Okay, welcome everybody. Sorry, we're a bit late. It's my fault. I was walking the dogs and now I'm suffering with hay fever. So, got my comeuppance. So welcome, Odette. Thank you for joining me live for some Q&As. For people who maybe didn't join the summit, so they don't know yet fully about you, do you mind just telling us about who you are and what you do?
Yeah, no worries. So I'm Odette. I'm a children's nurse specialist. I work within dermatology and allergy services. Hopefully going to be joining you too soon in your clinics. So my background is that I'm a children's nurse, have been for almost 30 years. So lots of experience in lots of different avenues of children's nursing, but primarily dermatology and allergy now.
Yeah, perfect. And you've done the Masters in Allergy as well, haven't you?
I have indeed, yes.
So super experienced and running, of course, 2 of the modules on our allergy help course.
Indeed, looking forward to that and hoping to be able to answer lots of questions.
Yeah, if you're anything like me, you're thinking, it's coming up next week and I haven't finished writing. And now, because I've postponed mine, because we've got lots of people wanting to join us after payday, obviously, your module is first now. So you're, setting the bar high.
Oh, that sounds scary now.
No, you'll be good. Tell people, so you've got 2 modules. Tell people what you're planning on covering in the modules if they haven't bought yet.
So in the first module, really what eczema is, how to manage it, just the real basics about moisturizing, steroids, scratching, different things, different kind of hints and tips onto how to day-to-day manage it, really. Because I think that's the thing that doesn't happen out in most primary care services. It's around having the right education and just being confident to manage the flares and manage what's happening on a day-to-day basis.
Yeah.
And then I think the second module, we're aiming on covering some more different treatments and just really more hints and tips as to, according to the questions that come up after the first module, I just adapt and work through things as they happen.
Yeah.
But really just trying to make sure people are really educated around how to manage it, because I think that's what's really lacking.
Yeah. And I would say, because I've just been I'm just developing a module for people with hay fever. And for many people with particularly eczema and hay fever and children and adults, if they had the understanding that we're going to give them, they can take that information and knowledge to either a chemist, because some of these things you can buy it obviously across the counter, or to their GP and say, well, look, I've been told this is the evidence. And actually then you don't need to waste your money on specialists or all these fancy creams, because we're going to teach you and you're going to teach them how to do it properly.
Absolutely. And I think there's so much differing advice and guidance about different things. It's just being armed with, these are the things that could work for you and your child. And if you haven't tried them, then try them. There's no right or wrong answers with skin, and everybody's different, but there is no miraculous answer either.
No, but hopefully, I mean, sometimes it feels like a miracle, because when you see these babies, you and I both, or your older children, and you're just thinking, I want to get my hands on them, because most of them, just some, sensible steps, and we can revolutionize the skin in a week or 2. Not get rid of eczema, because it doesn't work like that, but, get it under control, which is missing often, I think.
Definitely. I have so many families that come to clinic, spend 45 minutes to an hour with me and go away, and then email me a couple of days later and say, wow, or I'll phone them in a couple of weeks to see how things are. And they're just like, even after 5 days, it was so much better. We haven't had that for 6 months. So, we can help. And it's just about getting the right steps in place.
Yeah, it's so gratifying then, isn't it? Because I think it's one of those things in medicine that you get a really quick improvement, and people are incredibly grateful, because eczema has such a detrimental effect on everybody's life. So it's a good specialty to do.
It does. It's tricky sometimes, and you don't always get it right the first time. And, I often say to families, it's a mountain. We can't often climb a mountain in a day, but it's a journey and we will get there. And I think just giving them the confidence that somebody's actually listening, taking time, offering some fairly sensible advice.
Yeah.
Then you can.
Yeah, I had a mum reach out a mum reached out and she's on our group. I'm sure she won't mind me telling. And, you know, baby's really got very terrible eczema and allergies and had been referred to Great Ormond Street. And afterwards, I was like, well, do tell me what they say. And it was literally nothing different than what we say. But they just spent time with her explaining all the steps that I know you're going to go through. So it's not even like the super specialist centres have got secrets hidden up their sleeve. They're just doing the same that we do, but just, you know, they do it well because they spend the time with them.
I think the time is the key, because actually, if you just get given a prescription and told to go and get it from the pharmacy and take it away and use it, and you don't really know how you're using it, or you don't know what each thing does and how to apply, and you know how long things are going to need to be used for, or how much needs to be used, then it's not a surprise that you're going to go round and round in circles.
No, I know. It's like that old, what's the House? Did you ever watch House? I used to love House when I had time to watch telly. And he gave a great demonstration of asking a lady who was a bit crazy how to use a blue salbutamol inhaler for her asthma. And it was always played then at medical school, but basically she applies it like a perfume. Like wonders why her asthma's not controlled. And a really like great reinforcing point for doctors and nurses and everyone to learn that don't assume, like, you laugh at her, but actually why, if you'd never seen someone with asthma, would you know that necessarily where you were meant to apply that inhaler? So it was it was comical, but it's just, you know, the same advice, that don't assume people know how to use medicines until you tell them.
No, and I get so many families that say, well, I put the moisturizer and the you know, the treatments on the dry areas, but actually that might be 2 or 3 areas on the body, but they're not covering the whole thing. And actually just when they change what they're doing, it makes such a difference. So I think I've always had a bit of a mantra: if you're well educated about the condition, you actually understand what's happening, and then as a parent, you're in control. Because so often you're out of control, aren't you, with eczema and allergies?
Exactly. Well, it's about empowerment, isn't it? That's the whole point of the course. So we've had some questions for those who, you know, are waiting for your course to develop, and but particularly because it feels like summer and people are going on holidays, which is great to hear that they're going on holiday and not putting it off. But so lots of questions about what sun cream and how do they apply the sun cream when they've got their regime of moisturizing like 20 times a day. How would that look?
Okay, so firstly, holidays are holidays. Let's remember that, because actually they're there to be enjoyed. Holidays are often less stressful, so skin can often get better. The sunshine often makes skin better as well. So if you're jetting off somewhere nice and warm or enjoying the English summer, then sometimes the sun does make it better. So that's, I suppose, the first point to say. There's no right or wrong answers with regards to sun cream. It's very, very individual. But years of experience of having families spending an absolute fortune on sun cream has taught me that sometimes it's worth trying the lower end sun creams, so own brands, particularly things like the supermarket brands or Boots, just because the own brands tend to have less fragrance. And if you tip them over and have a look at the ingredients list, it's often much smaller than the branded sun creams, because often they have more ingredients, they smell nicer, and because you're paying more, they feel they have to put more chemicals in them. So a little bit of patch testing is probably a very sensible idea. So applying a little bit onto an eczema-free bit of skin for a few nights. If it doesn't trigger a bit of eczema, then obviously trying all over and seeing. But I often advise mums, if they've got friends with sun cream, try sun creams between you. Don't go spending a fortune, because that's often really helpful.
Yeah.
With regards to the other end, if you've tried a few of the cheaper ones and you're really struggling, then there are some brands. Sunsense Sensitive always used to be my go-to, but Sunsense has become very difficult to get here in the UK. So although it is still available, it is much harder to get hold of. So there are other brands that are coming up behind, and certainly La Roche-Posay's Thelios is proving to be very helpful. You've also got other brands like Eucerin, Neutrogena, there's Uvastat, and Ultraist, although Ultraist is probably the top end price bracket.
Ultra expensive.
Absolutely. But I suppose the thing that I recommend most are the UV suits, because actually if you put your child in a UV suit, you're needing to use much less sun cream. So that actually reduces the amount that you're using. Children who have kind of very irritated eczema are likely to be irritated by any sun cream that you put anywhere near them. So having a really good regime before you go on holiday of getting the skin as well moisturized and treated as you possibly can will make your holiday much more enjoyable. But also when you're away, moisturize in the morning really, really well. Apply your sun cream during the day. If you're stopping at lunchtime and having some shade, moisturize again, then apply your sun cream in the afternoon and do a really, really good evening regime. Because I think we get really hung up on moisturizing every day because that's the right thing to do. But actually you do want to slacken off on your holiday if you can.
Yeah. And half an hour or so between moisturizing and sun cream. Ideally,
yes. There's different schools of thought about whether you apply your moisturizer first or your sun cream first. Often it's easier to moisturize, have lunch or have breakfast, and then sun cream on afterwards, just because that fits the routine a little bit better. But again, it's very personal, and different people will advise different things. But as long as you're using both, and with sun creams, often the lotions or the sprays are often more helpful than the thicker creams because they require less rubbing and they're easier to apply. But I do usually recommend steering clear of the children's sun creams that are coloured, because the sort of purples and greens can sometimes irritate the skin.
Good tips. What about, do you have any tips for insect repellent? Somebody asked me that and I was like, oh, that's a good question. Not necessarily thought about that, but I could imagine that they might irritate the skin, but you might really
There's
need
lots.
to use them.
Absolutely. So obviously avoidance where possible. Long sleeve clothing, long legged clothing is helpful. If you're in an area with insects that are likely to bite, then sometimes you do need to use it. I think Jungle formula still have their very gentle children's formula, which is slightly less on the kind of, I suppose, offensive route from a smell and not so chemically, so that's often quite helpful. But I have a lot of mums who use the Avon's Oh So Soft spray, which isn't a recognized insect repellent, but seems to work really, really well. So it's a really odd combination of things to try, but sometimes it's worth a try. Clearly, if you're going to a malaria area, you need to be using a good insect repellent, and that is likely to irritate the skin. But if you're on a European holiday that doesn't require too much, then avoid where possible.
Yeah, that's what I said. If it was like, malaria center, you're going to have to just put the stuff on because malaria kills. But if it's European, it's a bit different.
There are bans as well. I suppose there are insect repellent bans. Which I've got a couple of mums who used last year, and they went, I can't remember whether they went to the Caribbean somewhere, and they actually put them on the children's legs rather than arms, so that they actually weren't bothered by them, and said that they didn't irritate. So I suppose that's the other thing to look at.
Yeah, we use those actually on the children. They just all wore them. It was a bit easier than adding in, and I'm never massively keen on using lots of DEET across their skin either. So we bought the band. Wow, it seemed to work.
I think there's a couple. There's the slap band, which is much more of a firm bracelet type band, which you can put around their ankle or around their wrist, or there are the stretchy ones that look a bit like a hair tie.
Yeah, so I think that's what we
several available.
Yeah, and one of the mummies said, "What about swimming? Is it a no-go, or can you do it?"
Oh no, take them swimming. Swimming's really, really important. They need to swim. Greasing moisturizer half an hour before they go swimming. If you're swimming here in swimming pools, some pools will use chlorine, some will use ozone. So there are different sort of levels of chemical. If it smells of chemicals, then it's strong, and often the baby pools are quite strong because that's where the accidents tend to happen. So just being aware of that. So moisturize well before, not too close to going in the water, because otherwise you have quite slippery fish. And you obviously want to make sure that the children are really safe, or the babies are safe. So if I usually say moisturize before you leave home, by the time you've got ready in the swimming pool, and then actually into the water, it's soaked in really well. But again, shower off, moisturize again afterwards. If it's flared in the evening and you've got some topical steroid, just use it, because actually swimming is really important.
Yeah, swimming's a life skill, and the younger you go, the more likely they are to enjoy it and learn all the. We took ours from, I think, like 8 weeks, and then they learned to swim underwater. They were proper fish, and 2 of them had eczema, and we still went. It's really important.
And sometimes swimming in the sea is fine and doesn't irritate as much as people think it's going to irritate. So, you know, if you're going on holiday and you want to take them in the sea, do so, because people add dead sea salts to baths and things. So a bit of salted water from the sea salt won't do them any harm.
Might help, yeah. And like you say, you can get like some of the swimsuits as well that are, well, swimsuits, but also barriers for the sun, and they might help protect against a bit of irritation.
Or a little wetsuit, you know, sometimes the wetsuits are useful. So there are lots of options available. Long sleeved, long legged, you know, that really does protect the skin and stop it from flaring so much, rather than a little swimsuit or a pair of swimming shorts. So, you know, it's very personal choice. But I think if you've got a baby with very irritated skin, putting them in a UV suit or a little wetsuit will offer some protection.
Yeah. One of the mums said her child, they've got a good management plan, skin looks better, they can't see any obvious patches, but still very itchy. What does that mean? Does that mean that they haven't got it under control, or what would you suggest?
So itching, unfortunately, once babies or children have scratched about 10 times, it does become a habit, and they will often just scratch just because. Obviously, if there is any inflammation or underlying inflammation that hasn't been treated very well, then the skin can be very itchy. But if you've got a good routine and the skin is well controlled, I suspect some of the scratching is habitual. And we see it a lot more, some babies, but a lot in toddlers. So certainly with certain words. So if you say no, or they can't have something, then often they'll take themselves off and have a little scratch, and it becomes a bit of a behavioural game.
So it might be worth looking at, actually, you know, are the scratching patterns happen around times where they're a little bit stressed, not, you know, and that's linked. Absolutely.
But also children scratch much more when they're tired. So around nap times or around, you know, after tea, they'll definitely scratch more if they're hot. So we know that temperature changes make a difference to how itchy children are. It's really difficult because there will be patterns, but sometimes you're so embroiled in the whole situation that you just think they're scratching constantly without kind of looking at other little patterns that are happening. Often you can see that it's either they're going down with a virus and they're starting to scratch a bit more because that's a subtle sign that their skin is going to flare, or that they're tired, or that they've just learnt to scratch. Certainly with the toddlers, distraction is a great thing. If you can distract them, they stop scratching. But with babies, it's a little bit tricky.
Yeah, I think some people not forget, but if you've got no comparison because you've only had children with eczema or allergies, you don't know necessarily what normal babies do. And you know, the ones that didn't necessarily have the eczema in our household, the telltale sign when they were tired was they would start, you know, itching their ears and their side of their head. And then I'd be like, oh, we're tired. Woohoo. It's time.
But that's a normal developmental pattern. And people often say to me, oh, but my baby pulls at their ear and then it splits. But if there's a bit of eczema behind the ear will split. But the pulling of the ear, or the rubbing of the head, or the scratching of the back of the neck, those are all just normal developmental baby processes that they go through when they're tired. But if you've got an eczema there, that rubbing or scratching or pulling may just trigger off something that needs to be treated.
I've got another question for you, which is, if they have eczema and the skin is red, but they don't necessarily seem bothered, so they're not particularly itching it, would you always say that we need to step up and use steroids, or can you just leave it sometimes?
If it's not bothering them, it's a tricky one, because if it's red, there's inflammation there. And if you leave inflammation, it tends to get worse. So yeah. I'm very much of the proactive treatment. So if there is something there, treat it, because it's not going to get worse. And it might only need a few days of treatment to disappear.
Yeah.
But if you leave it and it gets worse, you might be using your treatments for a lot longer to actually get to a level where things are treated. So it's I suppose a very individual decision to mummies that are looking at that and seeing it. But I think I would be tempted to jump in and treat, because I know that if you treat small patches, they go away. Whereas if you leave it, often it takes more weeks of using treatments that actually get the same response.
Yeah. And of course, there are sometimes skin rashes that happen in children that are red, but aren't eczema, yeah. Aren't there?
Absolutely. So teething, we all know that cheeks go bright red before teeth, but if you've got an eczema on a face, is it eczema or is it teething? You know, if you're in doubt and you've got some treatment, try it and use it. Equally, if you want watch and wait, you can do. And you know, viruses give children lots of red blotchy rashes, which don't necessarily mean that it's an eczema.
Yeah. I see so many children brought, as I'm sure you do, with it. Is it a food allergy? Because particularly ketchup and tomatoes, because it makes them go bright red, really dramatic often, like it makes them look like they've been burnt, but they're not bothered by it. And that's a key feature. So they don't itch like they would with eczema. They don't necessarily have eczema elsewhere. And it's often more related to the histamine in the food and essentially harmless. It just goes away again.
Absolutely. And I think with the inclusion of aubergine being a weaning food, that's definitely causing a contact reaction. We're seeing more and more different combinations of foods that cause a contact reaction, and it is all to do with the histamine content. But if it goes red and it settles within an hour and it all disappears and it's related to food, and often a greasy moisturizer to the hands and face pre-food is helpful, because it will stop that from happening. But if it doesn't go away and you're worried about it, then treatment is there to be used. But so many rashes just come and go.
Yeah, they do. Some children, my third was like that. She did have eczema, but also she's just rashy all the time for years. But by, I think, 3, 4, it all went away. It was just gone. It was one of those preschool things that you kind of just see in some children. Couple of questions. So last summer we were using Protopic on my daughter's face, but obviously lots of caution around the sun, because if people don't know, there's worries with Protopic about small risk of skin cancer. But they've said she's weaned off it now. So does her exposure risk return to the same as everybody else's?
Absolutely. The thing with Protopic is use it at night, so that you have to go sort of 6 to 8 hours out of the sunshine if you're going to use it. But if she's not using it and her eczema is well controlled, then just back to normal sun exposure risks as they were before. So using good sun cream is essential.
Yeah. And then any specific advice for follicular eczema?
So follicular eczema is a tricky one, because it's generally quite hard to manage, because once you've blocked, it's a hair follicle that's blocked that causes that spotty appearance, can sometimes get quite pustular and look quite angry for quite a long time. So smoothing of creams or ointment is essential, following those of the hairs, so generally in a downward kind of area fashion. It's very difficult to treat, so you have to be quite persistent and you have to hang on in there. So if it's pustular, sometimes the antibiotics stroke steroid creams are quite helpful as a bit of a combination to topically treat an area, because you can treat very small areas. But if your child is slightly prone to having a blocked hair follicle, then maybe using the cream versions of the moisturizers for a while, rather than too much oily grease moisturizer, may just help to resolve it.
Perfect. Thank you. Well, thank you, Odette. I'm going to go and do the school run. So it's just a quickie, just to give everybody a bit of a taste of the things that we'll be talking about. And as you do your modules, I'll help facilitate some questions. So we're going to, as we say, just a reminder, it will be, what is eczema? A lot of people will be wanting to know, is it an allergy? Are there allergic links? How can they tell? How can they treat it properly? And you'll be giving them all the skills to take along to their doctors to say, this is what I think I need to do, and this is why. And for those small proportion of people where the kind of mainstream treatments aren't going to work, we'll be talking about what would be the next steps and how you're getting into those specialist services to help you.
Lovely. Thanks very much, Helen.
Right, thank you. I'll share the links for anyone that just wants a reminder of looking at those modules. And as a reminder, you also get 3 months into the membership. So you get all the Q&As after all the talks, whether you've come to those or not, and lives with me and meetups and all our speakers coming in to chat. So thanks, everybody. Thanks, Odette. I'll see you soon. Bye.
Thanks.